Up to 85% of women who deliver a baby vaginally, they experience some degree of perineal tearing.
Right.
And we prepare mothers for that. We prepare them for the stitches, the ice packs, the bleeding.
Yeah, the immediate aftermath.
Exactly. The immediate physical aftermath of bringing a human into the world. But looking through the stack of sources you shared with us today, there is a secondary and often permanent physical change that happens to the body that society almost never talks about.
No, we really don't.
Right. So today we're taking your research, which ranges from, let's see, cosmetic surgery clinic guidelines and prospective psychological studies, to a formal committee opinion from the American College of Obstetricians and Gynecologists.
It's a lot of data.
It is a lot. And we're examining the hidden physical and emotional landscape of postpartum intimate anatomy.
Yeah, because the changes a woman's body goes through after childbirth are just, I mean, they're profound, but they exist in this sort of strange medical twilight zone.
What do you mean by twilight zone?
Well, because we don't talk about them openly, it becomes incredibly difficult for patients to separate what is a normal, albeit uncomfortable part of postpartum shifting from what might actually require medical intervention.
And that lack of clarity is exactly why we're taking this deep dive for you, our listener.
Absolutely.
Okay, let's unpack this. Our mission today is to answer one highly specific, deeply personal question based on your sources. Can labial majora augmentation actually improve intimate confidence and body image in women experiencing post-childbirth genital structural changes?
Right. That is the core question.
But to even begin evaluating the solution, I feel like we first need to understand the underlying mechanisms. Like, we need to look at what is actively happening to the tissue and the hormones during and after childbirth that drives women to even seek out these procedures in the first place.
Yeah, you really have to look at both the sheer mechanical stress and the intense endocrinology of pregnancy and delivery. So mechanically, during a vaginal delivery, the vaginal canal and all the surrounding tissues, they are forced to stretch to an extraordinary degree to accommodate the infant.
Which makes sense.
Right, and you mentioned the 85% tearing statistic earlier, which highlights just how extreme that structural demand is.
Yeah, that's a huge number.
It is, but beyond the superficial tissue, the deep pelvic floor muscles, specifically the pubococcygeus and bulbocavernosus muscles.
The deep muscles.
Yeah, they are stretched way beyond their typical physiological limits.
Wow.
And they can sometimes separate or suffer these little micro tears.
Okay, so the structural stress, that makes intuitive sense. You are pushing a baby through a relatively small canal.
Right.
But your sources emphasize that the mechanical stretching is really only half the story. There is this massive hormonal crash that happens the moment the placenta is delivered.
Oh, totally. The hormone drop is arguably more responsible for the specific anatomical changes we're discussing today than the actual delivery itself.
Wait, really? More than the actual physical delivery?
Yeah, because during pregnancy, a woman's body is just flooded with estrogen.
Okay.
And estrogen is the primary architect of tissue elasticity, collagen production, and hydration in the vulvovaginal region.
Oh, I see.
It also maintains the specific subcutaneous fat pads in the labia majora, which are the outer vaginal lips.
So the labia majora are essentially composed of skin and that fatty tissue acting as a sort of protective barrier.
Precisely. They are basically a biological cushion.
Okay.
But when a woman gives birth, her estrogen levels just plummet.
Just drop off a cliff?
Literally. Sometimes it even mimics menopause.
Oh, wow.
Especially if she is exclusively breastfeeding, which further suppresses the estrogen.
I didn't realize that.
Yeah. So when that hormonal support vanishes and the body begins its natural postpartum fat and fluid loss, the adipocytes, the fat cells in the labia majora, they shrink dramatically.
Okay.
Clinicians actually refer to this as the deflation effect.
The deflation effect.
Yeah, the outer lips just lose their volume. The skin, which was all stretched out during pregnancy, it no longer has the underlying fat to keep it taut.
So it's just loose skin at that point.
Right, leading to a wrinkled, flattened, or kind of asymmetrical appearance.
Reading the clinical descriptions of this volume loss in the sources, it instantly reminded me of the mechanics of facial aging.
Oh, that's a great comparison.
Yeah, because we know that as we get older, our faces lose those youthful underlying fat pads, right?
Exactly.
Our collagen production slows down, and the skin begins to sag or look hollow simply because the scaffolding underneath has deteriorated.
Right, the support structure is gone.
Right. And people frequently use dermal fillers in their cheeks or tear troughs to combat that specific deflation.
Yes.
It seems like the exact same mechanical and hormonal starvation is happening to the vulvar tissue, just radically accelerated by the physiological demands of carrying and delivering a baby.
You're exactly right. The underlying mechanism is nearly identical. You are dealing with sudden volume depletion and compromised tissue elasticity.
Yeah.
And because the outer labia have lost that fatty scaffolding, they can no longer fully close over or protect the labia minora, the inner lips, or the clitoral hood.
Okay, so we understand the physiological mechanisms causing this deflation, but looking at the daily impact on a mother's life, I mean, losing some structural volume in an area most people don't see, it doesn't immediately sound like a medical crisis.
Well, it's not a life-threatening crisis, no. But the functional discomfort can severely impact a patient's quality of life.
Also.
So the labia majora are designed to be a friction barrier and a temperature regulator.
Okay.
When that protective fatty padding is depleted, the highly sensitive inner structures are suddenly exposed to direct friction that they were never biologically designed to handle on a constant basis.
Oh, I see. So it's not just cosmetic, it physically hurts.
Exactly. Women report intense physical irritation just trying to go about their normal days. We see complaints of chafing when walking, sharp discomfort during exercises like cycling, running, or spinning,
Oh, gosh.
and constant irritation when wearing form-fitting clothing like yoga pants, leggings, or swimwear.
Wow, so you're recovering from childbirth, you're trying to re-engage with your life, maybe get back to the gym for your mental health, and you're experiencing active pain just from the seams of your clothes.
Right. It's incredibly frustrating.
But the sources you shared heavily emphasize an emotional disconnect that runs parallel to this physical pain.
Yes, very much so.
Mothers in these prospective psychological studies report feeling totally alienated from their own bodies. They describe a profound grieving process for their pre-baby anatomy.
Which is very common.
Yeah, and many feel so hyper-aware of the altered appearance and the physical discomfort that they actively avoid intimacy.
The psychological burden is frequently the primary catalyst for seeking a surgical consultation.
Really, more than the physical pain.
Often, yes. I mean, the physical chafing is a nuisance, but feeling like a stranger in your own skin or feeling actively distressed by your own reflection, that takes a severe toll on postpartum mental health.
I have to ask a question about this data, though.
Sure.
You noted from the sources that mild prolapse or visible tissue laxity affects up to 50% of women post-birth.
Right, up to half.
And tearing affects 85%.
Right.
If this structural shifting is an almost universal, mathematically normal experience of mammalian childbirth, why is the emotional toll characterized by such intense isolation? Why do so many of the women in these studies report feeling completely alone in this experience?
Well, if we connect this to the bigger picture, the isolation stems from a systemic failure in how we educate patients about postpartum reality.
A systemic failure.
Yeah, we meticulously prepare expectant mothers for contractions, for sleep deprivation, for the mechanics of breastfeeding.
Right.
But we almost never discuss the long-term, potentially permanent architectural changes to the vulva and vagina.
We just skip right over it.
We do, because society treats this specific anatomy as taboo, so when a woman looks in the mirror and sees profound deflation or laxity, she lacks the framework to say, oh, this is a recognized expected phase of my body's postpartum evolution.
That makes so much sense.
Instead, she internalizes the change as a defect. She assumes she is broken. We have taken a standard physiological shift and allowed a vacuum of information to turn it into a source of deep personal shame.
That is just so sad. The transition from viewing oneself as healing to viewing oneself as broken, it's a tragic consequence of that silence.
It really is.
But okay, if volume loss and the resulting lack of protective cushioning are the root causes of both the physical chafing and this intense emotional distress, we need to look at how modern medicine attempts to reverse it.
Right, the solutions.
Yeah, the sources detail the augmentation solutions, but there is a lot of confusing terminology in this space that I think we need to clear up first.
Yeah, the terminology is frequently conflated in popular media, so many people use the term labiaplasty as a blanket statement for any cosmetic genital surgery.
Right, I hear that word a lot.
But medically, labiaplasty refers to a reduction procedure. A surgeon trims or alters the inner lips, the labia minora, typically because they are protruding or causing discomfort.
Okay, so labiaplasty is reducing.
Exactly. Whereas labia majora augmentation, or LMA, is the inverse mechanism.
Okay.
It is an additive procedure. It's designed to restore volume, cushion, and structural support to the outer lips.
Taking away versus adding back. Got it.
Mm-hmm.
So to achieve that additive volume, the cosmetic guidelines in our source stack outline two primary medical pathways. Let's start with autologous fat transfer.
Okay, so autologous fat transfer involves harvesting the patient's own adipose tissue and repurposing it.
Their own fat.
Yes.
Yeah.
A surgeon uses a specialized gentle liposuction technique to extract fat from a donor site, usually the abdomen or the inner thighs.
Okay.
But that harvested fat cannot just be immediately injected right back in.
Why not?
It must be purified in a centrifuge to isolate the healthiest, most viable fat cells. And then once it's purified, the surgeon carefully grafts those cells into multiple layers of the labia majora.
Oh, okay. But because the surgeon is transplanting the patient's own biological material, the risk of an allergic reaction or, foreign body rejection is virtually zero, right?
Right. The biocompatibility is the primary advantage here. The augmented tissue feels completely soft and natural because it is natural fat.
That makes sense.
However, because it is a tissue graft, the transferred fat cells must establish a new microvascular blood supply in their new location to survive.
Oh, they have to root themselves.
Exactly. And not all of them will. The body typically reabsorbs a percentage of the transferred fat over the first few months.
So it shrinks a bit.
It does. But the fat that does successfully revascularize offers a permanent restoration of volume.
Okay, but this is a surgery.
Yes, this is a surgical intervention requiring anesthesia, incisions at the harvest site, and a dedicated recovery period.
That brings us to the second method, which seems to cater to patients looking to avoid surgery.
Yes.
Hyaluronic acid, or HA, fillers. So from what I read, this is an in-office procedure requiring no liposuction and almost no downtime.
Correct.
The practitioner injects a cross-linked hyaluronic acid gel directly into the depleted tissue of the labia majora.
Wait, so women are essentially getting lip filler, but for their outer vaginal lips?
Yes, that's exactly what it is.
Because I was reading the chemical breakdown of this, and it's essentially the exact same filler compound used globally for lip augmentation and facial contouring.
It relies on the exact same fundamental molecule, yes.
Wow.
And hyaluronic acid is naturally occurring in the human body anyway. What makes it so effective for this specific postpartum deflation is how the gel interacts with the surrounding tissue at a cellular level.
Yeah.
It doesn't just sit there occupying empty space like an inert silicone implant would.
Yeah, right.
Hyaluronic acid is intensely hydrophilic, which means it acts like a microscopic sponge, drawing in and holding water molecules. So it's actively rehydrating the tissue from the inside out.
Exactly. And furthermore, introducing this dense gel matrix into the tissue physically stretches the fibroblasts.
The fibroblasts.
Yeah, those are the cells responsible for generating connective tissue.
Oh, okay.
So this mechanical stretching, known as mechanotransduction, tricks the body into thinking the tissue is under tension.
And what does that do?
That stimulates the fibroblasts to synthesize fresh, new collagen.
Oh, wow. So it's not just temporary fluff.
Right. The filler not only restores immediate volume, but it actively remodels the dermis over time. It improves the actual elasticity and thickness of the skin.
That's fascinating.
It is. This is particularly effective for correcting the creepy, wrinkled texture that follows extreme pregnancy stretching.
Okay, so the mechanical logic is totally sound. We know the procedures physically plump the tissue, they trigger collagen remodeling.
Right.
But we have to bring this back to the core question you asked us to investigate.
Right.
Does restoring that physical volume successfully heal the psychological and intimate disconnect these women are experiencing? Because the clinical studies you provided present a really fascinating, highly nuanced picture here.
Very nuanced.
Let's examine the Isolane study. That was the randomized controlled trial specifically testing HA fillers for labia majora hypertrophy, which is the clinical term for that deflation.
Yeah, the Isolane data is really compelling. They compared a treated group to a control group, and they tracked outcomes using established medical scales.
Okay.
The women who received the hyaluronic acid injections demonstrated statistically significant improvements on the Female Sexual Function Index, or the FSFI.
What does that measure exactly?
That scale measures distinct domains of sexual function, including arousal levels, natural lubrication, and just overall satisfaction.
Okay.
And the treated group also showed dramatic improvements on the Global Aesthetic Improvement Scale.
Right. And we see similarly positive physical outcomes in the 2016 prospective psychological study by Sharp and colleagues. They tracked women undergoing labial alterations and found that over 82% of the patients were satisfied with the aesthetic and functional results of their surgeries.
Right. Physically, the patients achieved their goals, they liked the restored appearance, and the functional chafing and friction were alleviated.
So if the goal is strictly anatomical restoration and the reduction of localized physical discomfort, the data suggests these interventions are highly successful.
They are.
But here's where it gets really interesting.
Oh, yeah.
I dug into the crosstabs of that Sharp study, and there is a massive caveat that fundamentally alters how we should view these procedures.
Absolutely.
While the women's dissatisfaction with their genital appearance dropped significantly, meaning they achieved the aesthetic result they wanted, the surgery did not produce any measurable improvement in their general psychological well-being or the overall quality of their intimate relationships.
Yeah, and that data forces us to separate localized body image from holistic mental health.
Right.
I mean, the Isolane filler study utilized the Perceived Stress Scale, or PSS, to measure overall psychological burden. When researchers compared the treated women to the control group, they found absolutely no statistically significant difference in their overall stress levels.
Not at all.
None. Altering the anatomy resolved the local complaint, but it did not rewire the patient's broader psychological state.
Wow. And the Sharp study uncovered a correlation that seems entirely paradoxical on the surface. They found that patients who were in a romantic relationship or patients who had pre-existing psychological distress were actually predicted to have much lower satisfaction rates with the surgery.
Right.
Why would being in a relationship make a patient less satisfied with a procedure that's explicitly marketed to improve intimate confidence?
Well, the paradox dissolves when we look at the psychological burden of expectations. If a patient is navigating postpartum depression, profound emotional distance from her partner, or a fundamentally fractured marriage, and she seeks out this augmentation believing that fixing her anatomy will serve as a catalyst to fix her relationship.
Oh, I see.
Yeah, she is setting herself up for devastating disappointment. A hyaluronic acid filler cannot bear the weight of clinical depression or marital breakdown.
Right, it's just a filler.
Exactly. If the underlying dysfunction is a lack of communication or emotional intimacy, restoring volume to the labia majora does not address the root pathology.
So who actually is satisfied with this?
The data clearly shows that the patients who experience the highest satisfaction are those driven by intrinsic motivations. They want to exercise without pain, or they simply want to feel physically comfortable in their clothing, completely independent of a partner's gaze or a struggling relationship.
I gotcha. So we can confidently conclude that these augmentations fix the mirror. They fix the chaving in your spin class. But they are emphatically not a psychological cure-all for a struggling marriage or the complex emotional turbulence of the postpartum period.
Exactly.
Given that the psychological benefits are so narrowly confined, we need to look at how the broader medical establishment views the safety and necessity of these procedures. Because the American College of Obstetricians and Gynecologists, ACOG, issued Committee Opinion Number 795, and their stance is one of extreme caution.
Yes, ACOG's position is unequivocal regarding elective female genital cosmetic surgery. They explicitly state that unless there is a specific clinical indication,
Like what?
like surgical repair after a severe 3rd or 4th degree tear or reconstructive surgery for prolapse,
Okay.
but outside of that, procedures designed solely to alter sexual appearance are not medically indicated.
Wow, they just shut down.
Pretty much. Their primary concern is the glaring lack of robust, long-term, peer-reviewed data proving the lasting safety and psychological efficacy of these elective interventions.
And they outline the physiological risks in stark detail. With autologous fat transfer, because it is a surgical graft, patients face the standard risks of bleeding, systemic infection, and scarring.
Right.
But there's also the risk of fat necrosis, where the transferred tissue fails to establish a blood supply, dies, and forms hard, painful cysts.
Which is very painful.
And with the HA fillers,
Yeah.
ACOG warns about the formation of nodules.
Yes, the nodule risk with fillers is deeply tied to the specific anatomy of the vulva. This tissue is highly vascular and incredibly dynamic.
Okay.
If a practitioner does not inject the hyaluronic acid gel into the precise fascial plane, or if they inject too large a bolus.
A bolus, like too much at once.
Yes, exactly. The body's immune system can recognize it as a foreign invader and encapsulate it.
Oh, wow.
This walls the gel off, creating a firm, painful granuloma that often requires medical intervention to dissolve.
Like,
And furthermore, Any intervention in this nerve-dense area carries the risk of altering or permanently dampening sexual sensation.
That is a major risk.
It is.
ACOG also dedicates a significant portion of their opinion to calling out deceptive marketing practices within the cosmetic industry.
They do, and they are highly critical of clinics that take established traditional gynecological surgeries.
Like what kind of surgeries?
Well, like a colporrhaphy, which is the surgical repair of a weakened vaginal wall. They take those and rebrand them with terms like vaginal rejuvenation or designer vaginas.
Designer vaginas,
Yeah.
right.
This marketing language obscures the reality that these are serious medical interventions with potential lifelong consequences. They're selling them as casual lifestyle upgrades akin to getting a facial or a manicure.
So if a listener is, say, 6 months postpartum, experiencing this deflation, suffering from chafing and feeling disconnected from her body, and she reads this stern ACOG warning about the risks and lack of data, what are the medically recommended alternatives?
The absolute first recommendation across the literature is simply time.
Just wait.
Just wait. The endocrine system requires at least 6 to 12 months to fully stabilize after childbirth and the cessation of breastfeeding. The pelvic tissues need that same window to naturally involute and recover their baseline tone.
Right.
Intervening surgically while the body's hormones are still oscillating wildly is medically ill-advised. In many cases, the localized deflation and laxity improve organically as natural estrogen production resumes its normal cycle.
You have to let the physiological baseline reset before you attempt to permanently alter it.
Exactly. Now, if the patient is dealing with functional issues like extreme dryness or pain during intercourse, which severely exacerbates the psychological feeling of being broken, non-surgical therapies are the first line of defense.
Like what?
Targeted pelvic floor physical therapy can fundamentally restore tone, blood flow, and structural support to the entire region.
Okay.
For the tissue quality itself, localized low-dose hyaluronic acid suppositories or topical estrogen creams can dramatically improve mucosal hydration and elasticity without the risks of needles, fat harvesting, or anesthesia.
That sounds much less invasive.
It is. And regarding the chafing, the simplest medical advice is often the most effective. During that first year of healing, prioritize wearing loose, breathable clothing that accommodates the body's current state, rather than forcing it into restrictive athletic wear that causes friction.
Adjusting the environment to fit the body, rather than surgically altering the body to fit the clothes.
Precisely. This raises an important question, though.
What's that?
Well, ACOG also brings up a critical psychological screening recommendation that forces us to look at the broader cultural context of these procedures. They strongly advise that any woman seeking cosmetic genital surgery should be thoroughly screened for body dysmorphic disorder, along with depression and anxiety.
Oh, interesting. So they want to make sure it's not a psychological issue first.
Exactly. The screening recommendation requires us to ask a difficult analytical question. We live in a culture where pornography and aggressive cosmetic marketing have heavily normalized an airbrushed, digitally altered, virtually prepubescent-looking vulva as the sole standard of beauty.
Right, the standard is completely unrealistic.
So when a woman undergoes the extreme natural and biologically necessary anatomical changes required to carry and deliver a child, and then feels compelled to surgically erase the evidence of that process to match a marketed ideal.
We have to ask if we are pathologizing a normal postpartum body.
Exactly. Are we treating natural maternal evolution as a medical defect?
So let's pull all these threads together and return to the specific question you sent us to answer today.
Okay.
Can labial majora augmentation actually improve intimate confidence and body image in women experiencing post-childbirth genital structural changes?
Right.
Based on the clinical data and the physiological mechanics, the answer is a highly specific conditional yes.
Very conditional.
Right. If a patient's primary distress is rooted in the physical pain of chafing, the loss of functional protective cushioning, and a localized dissatisfaction with the deflated appearance of the outer labia, these augmentations work.
They do work for that.
Autologous fat transfer and hyaluronic acid fillers utilize clear biological mechanisms to restore tissue volume, alleviate friction, and significantly boost aesthetic confidence in that specific area.
But, and this is a big but, the data draws a hard boundary around those benefits. Restoring physical volume will not cure postpartum depression.
Right.
It will not repair emotional distance in a marriage. It is a localized anatomical tool, not a holistic psychological intervention.
Not a magic wand.
No. Furthermore, the broader medical community warns that these procedures carry real risks, necrosis, nodules, and altered sensation, and they shouldn't even be considered until the body's endocrine and structural systems have had at least a full year to naturally recover.
Before we wrap up this analysis, there's one final data point buried in the ACOG opinion that I feel completely reframes this entire discussion.
Oh, the measurement study.
Yes, ACOG cited a comprehensive study that set out to measure the anatomical dimensions of the normal vulva across hundreds of women of varying ages and reproductive histories.
And what they found is amazing.
The researchers found that over 50% of women naturally possess labial measurements that completely exceed the dimensions currently labeled by cosmetic marketers as hypertrophic or overly large.
Over half the population naturally falls outside the parameters of the cosmetic industry's definition of normal.
Exactly. The ideal being sold to women as the standard requiring surgical maintenance actually represents a mathematical minority of natural human anatomy.
It's wild.
It really is. So we'll leave you with this final thought. If the vast majority of women naturally exist completely outside the marketed cosmetic ideal, at what point does the pursuit of physical restoration cross a line? When does utilizing modern medicine to take control of our postpartum bodies stop being an act of empowerment and start becoming an act of conformity to a culturally engineered insecurity?
It's definitely something to think about.
Something to analyze the next time you encounter a brochure offering to rejuvenate your reality. Thank you for sharing these sources with us, and thanks for joining us on this deep dive.